It is special, it is unique and special, and it's not just the once a year travel to our in-person meeting. It's far more than that. It's the community that is developed throughout the course of the year that includes contact with individuals where we come together to solve common problems, to expose and identify dissimilarities, but also to identify opportunities for us to address common problems in the setting of sometimes dissimilar environments. Anytime you expose yourself to different ways of thinking, different types of practice, of course it's inevitable that you're going to learn something, and that has certainly been my experience. I think what is striking to me is how the U.S. health system largely operates in a single way. We make very similar assumptions across the U.S. when we deliver care. So it's very interesting to me to see how another country's healthcare system might be based on very different assumptions. So at the Atlantic Health System, we have really leaned into the idea of value. So quality, the highest experience, but also at the lowest cost. That still feels relatively new in the US. And yet, when I talk to perhaps my colleagues from Singapore that are managing population health very differently, it seems very familiar. And so there's an opportunity for me to learn from their way of thinking, and then of course the structures that they've put in place to drive the value equation in Singapore, and I can apply it to my own experience as we create similar structures at Atlantic. Again, their ability to manage populations and take accountability for the ultimate health of an entire region of people, I think is the way that we here in America, and certainly at Atlantic Health, need to begin to think about the communities that we serve. The way that we can come together as a community, learn from each other, and then develop those friendships and opportunities to grow together have really been special.